but it's not about you.
Right.
Beautiful.
Dang, that is brutal. Do you have an insider look at how these tests are conducted, and what do these tests, what do they consist of?
Oh yeah, absolutely. So this is a really important thing because I think that there's two different types of tests that are going to have played a huge role so far, and then how they're used in the future is going to govern a lot of what happens in terms of the policy side. So the first test is guys might have heard about like the nasal swab, where they stick this massive Q-tip up and hit your sinuses, which is really brutal.
Yeah.
That test uses enzymes from microbes to be able to basically make billions of copies of the genetic material of the virus over the course of a couple of hours. And
Nice.
so if a small amount of the genetic material of the virus is present in that sample, then in a couple of hours by doing that test, you have created enough copies where you can like detect its presence and like basically like looking at it and having a big band of in a gel of this genetic material, say, oh, there's that band, that means the virus is there. And so that is the test that is used to, when we hear about confirmed cases, that's the test that we use to diagnose, because that if the genetic material is there, it means that the virus is actively reproducing inside your body. It means that you have the virus, you're infected, and it's working, and it's kind of working in your body. So that's what we use to diagnose the virus. The antibody tests, which you're starting to hear more about now, have been coming out. They don't directly test for the presence of the virus. What they do is they test for antibodies in your bloodstream. And these antibodies are basically, what's the PBS NewsHour says, like the frontline foot soldiers of the immune system. They're large proteins that go through your bloodstream, and they're tailor-made to recognize very specific pathogens, or these microbes like bacteria and viruses and fungi that can cause disease, and other things. So they're basically looking like they're basically doing like a fingerprint analysis throughout your bloodstream of different microbes that are detected. And so if you have those antibodies in your system, it means that it doesn't necessarily mean that the virus is actively replicating and reproducing inside you. It does say that your body has started to mount an immune response to the virus being infected. And so the big question moving forward is an antibody test. If you're positive for these antibodies, are you infected? Are you immune? Right? Because if your body has started mounting an immune response, that doesn't necessarily mean that you are immune to the virus.
Right.
And so the antibody testing of trying to see how many people have this immune response is going to be answer a lot of really difficult and challenging and interesting questions on how many people were actually exposed to the virus and just didn't test positive for it with the nasal swab, a new genetic material test. Are those people immune? And do we have enough coverage of immunity throughout the population for us to be safe about it? And so that's how the two tests. The nasal swab diagnoses you because it shows that the virus is actively reproducing inside your body, and the antibody test gives you a test of whether or not your body has started mounting an immune response to the virus. But that does not mean necessarily that you are immune to the virus. It's a nuanced point, but that's really, really important for people to understand, because we're on calls with people, and it sounds like there are a lot of physicians out there who are ordering antibody tests, and then someone's positive for the antibody and they're still sick, and they're saying, okay, you're immune, you're good to go. No. That's something that's really important for a lot of people to understand. It doesn't matter if you're a doctor with 30 years experience or you've never taken a biology class in your life. The antibody test does not guarantee that you are immune to the virus.
Your immune system reacts to almost anything, right?
Yes. So you don't just have antibodies when you're infected. You have antibodies that will recognize parts of your body that they're not supposed to be in, right?
Yes.
That's the antibodies recognize cancer cells, and that's actually kind of a bit of an aside. Antibody therapies and immune cell therapies are being used increasingly to treat cancers, because you can actually design these in labs in order to recognize things like structures in the body that are weird or abnormal. So it's hard to do that. It's a bit of a challenge to do that, but it's something that's like emerging. So antibodies are not just for the virus or a bacteria. They're for a lot of different things, and your body's making them all the time. But the antibody tests in question, you can identify, because they're so unique, these different antibodies, you can identify which ones are specifically for the virus.